Hey, what's up everybody? It's Dr. Nick here. I'm just making this video for you guys that maybe you woke up with a crick in your neck and you're just trying to get rid of it. So I'm just going to give you some exercises and stretches that you can try to help resolve it a little bit quicker. So before we go into that, I wanted to give some background on why that happens. And so there's this phenomenon that your muscles exhibit called adaptive shortening, and what that basically means is that your muscles will naturally tighten if they're put in a position that puts them on slack. So just to give you an example, if I bend my arm like this, this muscle is shortening. If I straighten it out, it's lengthening. So if I were to sleep like this muscle would naturally just tighten up, and then when I wake up in the morning, if I go to stretch it, it's probably going to feel stiff, a little bit tight, and that's just, one of those weird things how your muscles behave. And so the same thing can happen with the neck. So for instance, if you sleep maybe in a super awkward position the whole night, all those muscles will tighten around the neck, and then when you wake up and go to move your neck, it's like it's stuck. And so if you sleep in a more neutral posture, making sure your neck isn't too far forward, like this, or twisted, just a nice natural curve the way your spine is naturally built, that usually puts you in a place to avoid, these issues. Alright, so let's get into the techniques that you can use to just get rid of, that stiffness. So the first thing is going to sound pretty obvious and basic, but it works. And it's just regular stretching, static stretching, dynamic stretching. And basically wherever you feel those muscles are tight, that's where you want to target your stretching. And so sometimes you'll need to both stretch the muscles, but then also you may need to also stretch the joints in the spine. And so we call those the facet joints, and I'll show y'all a little bit more about that here in just a second. But just to go over stretching, when you're doing it, you want to make sure to hold it at least 30 seconds before you take a rest. And the other thing is you're going to want to do it frequently throughout the day. Doing it just once or twice a day probably isn't going to cut it for you. Just in my personal experience, to really get a permanent change in the muscles and the joints, you really have to be diligent and do it throughout the day, multiple times throughout the day. So just to give you an example, let's say you have some tightness in the back of your neck. That's usually what happens. So you're going to want to stretch the muscles going forward or rotating. So a basic one you can do is bringing your chin to your chest like this, holding for about 30 seconds, and back. And you can do 3 to 5 sets of 10, and just a few times throughout the day at least. Rotation is another one that you can work on, just holding side to side, and then side bending. And really it's good just to make sure you can do all motions, so you can extend your head back, forward, rotation, and then again that side bending. Okay, so we covered stretching. Now let's talk about stretching of your joints. That was kind of more stretching of the muscles. So to stretch the joints, there's two things I like to try to use. The first one is called traction, and basically that's just a fancy term for when we are opening up the joint space and stretching the joints lengthwise. So let me grab my spine here and I'll give you guys a better description of what that is. Okay, so this here is the neck area, and so let's say I wanted to apply cervical traction to the neck. So what I would do is, if let's say I'm treating a patient, I usually have them laying down. So they're face up like this. And I will kind of cradle the neck here and just give a little bit of stretch, pulling. And what that is going to do, it's going to open up the joints, stretch the spine going this way. So it's almost like you're pulling your spine apart, which sounds weird. It sounds like medieval torture, but it can be very effective, and it actually feels really good if you have it done to you. So you can't always have somebody do that for you, and so they make these devices that you can do it on your own. They're called cervical traction machines or units. And so I got one here. I got off of Amazon for like, I think it was like 20 bucks, 30 bucks, something like that. But this is what it looks like. Kind of looks like a one of those travel pillows. And then it has this pump here that you use to pump air into the pillow. So the pillow will go around your neck like this. And then you just use these Velcro straps here to secure it around your neck. So I'll go ahead and demonstrate for you guys. Okay, so you want this not too tight, not too loose. And then as it pumps up, you want it to kind of anchor underneath your jawbone. We call it the mandible. And otherwise, if it's too loose, it's going to just go around your face and it's not really going to do anything. And so basically the pillow is going to be stretching under the jaw here and then on the top of the shoulders. Now also be very careful with these, because if it's too tight, you have your carotid arteries that run along your neck. And if that's too tight and you feel like you can't breathe, you're getting dizzy, you need to take it off immediately. So just be careful with that. Make sure it's not too tight. I only do it about 5 minutes at a time, and then maybe a few times throughout the day. But again, just be extra careful if you're going to use one of these. So the other way you can stretch the joints instead of the muscle is something called snags, or a snag, which that is an acronym, SNAG. And so what that stands for is sustained natural apophyseal glide. And that's just a fancy term for we're simulating the natural motion of the joints in your neck. So I'm going to grab my spine here again, and I'll give you guys kind of a better description of what that is. So this is a sideways view of your spine, right? So if we were to rotate, let's say like this is my spine, right? And it's like I pulled it on my body so you guys can see. So let's say I turn my head to the right, looking towards the door. This is kind of how your spine looks as you do that. So if you can't tell, the joints in your neck, they kind of glide upwards and forwards, and they call it an upglide. And so the way, let's say, you know, you slept and it's very tight in one of these facet joints, and so you want to work on that upglide. So you can use a belt, you can use a dog leash. I have something called a stretch strap here. And so what you can do is you'll find that tight spot just by feeling the back of your spine, and you'll feel the little bony spots down. Start at the very base of your skull and work your way down. That way you kind of know where the spot is. And it's usually towards the bottom. It's very common, you know, around C6, C7. And if it's tender when you push around there, that's likely where it's tight and needs to be stretched. So I'll stick this stretch strap around that spot there. And then what you're going to do from here is, let's say I need to, it's tight when I turn my neck to the right, so I'm going to work on that motion. So I'm going to cross this like this, cross the strap, and then switch hands. So I'll show that again just because it's kind of confusing. So first start like this, you'll cross it, grab onto both sides, and then what you're going to do, if I'm going to work on turning to the right, is We're going to hold down with this left arm, giving some pressure to stabilize on the back of your neck. But then we're going to also work on rotating, and then I'm just going to use this band, and it's pulling around the spine as I'm trying to actively rotate my spine, and so it's like it's giving you a boost. It's kind of giving you some extra pressure. So this is kind of what it should look like. And so I'm giving pressure down, but I'm also kind of pulling up and outwards. And I can feel the pressure around my neck. And it doesn't always feel great. Sometimes it's a little bit painful, but that's usually a sign that it's that area that needs to be stretched. And so you can do this maybe about 2 to 3 sets of 10, holding for about 5 seconds or so, and then maybe switch to the other side. So same thing, cross it, hold down with this right arm, and then we're going to work on twisting to the left. Now I will say it's a little bit easier if you're laying down. It's just your muscles are more relaxed, so try that one laying down, and it's usually easier. Okay, moving on. The last thing that can really be helpful is massage. So, you know, sometimes you may not be able to afford a massage. They're not cheap by any means. And I don't, you know, I'm not one of those where I can just afford to go get a massage every month or anything like that. So what you can do is just use your own hands. You don't have to have any like fancy massage tools or anything like that. But let's say I have a tight tender spot right in the middle, because that's a very common one people get is, you know, right in the middle between the joints. And so you can just grab 2 or 3 fingers, and you know, you kind of have to, it's like, you know, you're fishing. You're kind of like, you're digging all around the neck. You're trying to see, all right, where does it hurt? Because that's where you need to massage usually, is where it's tender and painful. Because if you think about it, if there's a tight muscle, you know, you have these pain receptors all throughout your body. They're all over the place in your joints, your muscles. And so if somewhere is tight, those pain receptors, and you push, you know, you push and overstretch them, they're gonna elicit pain. But if your muscle's already stretched out and you push on them, you're really not gonna feel much, because there's, you know, there's not as much tension on those nerves. And so feeling pain is a very normal part of the process, and often it's the areas where you feel pain is often where you need to stretch. So don't be too concerned. Now, you shouldn't have excruciating pain or anything like that, and if you do, please see your doctor to, you know, make sure that's, you know, there's all kinds of things that can stem from neck pain. So again, this is not medical advice. This is just for informational, educational purposes. Now I want to show you guys one more stretch that I like to do, and it's kind of a stretch exercise. So what you can do is grab a weight. I like to use a kettlebell. So just to show you, this is what a kettlebell looks like here. And so let's say I have a tight spot right here. It's kind of hurting around my shoulder. You can hold the kettlebell, let it pull your shoulder down, and you will feel that stretch on this side of your shoulder. You know, let it kind of sag, hold it there for about 10 to 30 seconds. You don't really want to try to like pull it up. You know, we're working on stretching, not so much trying to strengthen the muscle. So let it sag, and then what I also like to do is combine some side bending, cervical motion, and then rotation. And then you can also combine them. So you can start with side bending and then work in rotation, going as far as you can. And I guarantee you will feel a good stretch with this one. I always feel a stretch regardless if I feel tight or don't. And so that's a really good one you can try. If you don't have a kettlebell, you can just do it without it. You can can stick your arm behind your back. That kind of gives you a little bit extra tension. And same thing. And again, try maybe 2 to 3 sets of 10, holding for about 5 to 10 seconds each. And this is more of a dynamic stretch instead of a static stretch. Okay, so one last piece of advice I wanted to give is trying to mobilize your first rib. So what that basically means is you have your rib cage that starts, kind of around this area, and the first rib is at the top. And you have these tiny muscles called your scalenes, and they run from your neck to that first rib. And sometimes when you sleep, that first rib gets elevated and those scalene muscles get tight, as we talked about the adaptive shortening at the beginning of the video. And so to help stretch that, you can try what we call a mobilization of that rib. And so what I like to do is put my hand, so let's say it's tight on this side, right? So I'll put the palm of my hand on top of the shoulder here, and it's kind of hard to feel, but if you dig deep with your thumb or a finger, you can kind of feel a bony part around that shoulder, and it's a little bit uncomfortable usually when you press it. And if you kind of just dig down and then kind of twist your head, you can kind of wiggle that rib around and those muscles that are attached to it, which also run very closely to your brachial plexus, which is a big collection of nerves that just runs through the upper shoulder area. And so often, if you have pain around this upper shoulder and you work on stretching the upper trap here and those scalenes, that usually will take care of any of that pain there. Again, if you're having any other issues, I'd love to help you out. Please feel free to reach out on the website or through phone, email, whichever's best for you. We can easily help you get back to normal function and help get rid of that neck pain for you. All right. Thank you guys for watching. I hope you're able to fix that neck up pretty soon. Hang in there. I know it's not fun. And I'll see you guys next time.